Healthcare ought to be straightforward, efficient, and accessible for everyone. However, managing appointments, consultations, and reports is still often a complicated process. At Bacancy, with over 14 years of experience, we developed telecare to provide secure virtual care and streamline workflows. Today, I'm introducing Bacancy HIMS, our system designed to optimize hospital inventory while ensuring full compliance. Let's explore the system's landing page for a quick overview. You'll find features such as real-time inventory tracking, reduced wastage, improved procurement, and enhanced hospital operations. From this screen, hospital staff can log in, or a new hospital can register with ease. The registration process is quick and straightforward. If you already have an account, simply click Back to Login. Fill in your details and the system will assign permissions according to your role, then direct you to the dashboard. The dashboard provides a comprehensive, at-a-glance view of operations. Review inventory alerts easily and use the search function to quickly find specific items. You can filter inventory alerts by various statuses. Export your inventory alerts with a single click. The dashboard also features several charts to monitor performance, beginning with stock position by category. You can also see the most frequently used items based on stock movement. Additionally, there's a chart for stock value by category, as well as access to a list of items with low stock. Before carrying out any procurement or inventory tasks, master data must be configured. First, we set up items. Each item has a unique code, category, such as medicine, a unit of measure, reorder level, and shelf life. You can search by name, category, or branch. To add a new item, click Add Item, complete all required fields, and select Create. Select the View icon to see detailed information about a particular item, including its history and a stock trend chart. Use the Edit button to update the item's details. Update the information as needed. Next, let's move to vendors. Store supplier details such as name, contact information, license number, and payment terms. To add a new supplier, click Add Vendor and fill in all required details. Moving on to departments, you can manage your hospital department configurations and settings here. Administrators can add a new department to a specific location by clicking Add Department. Now let's look at the core workflow. Our system covers the entire procurement lifecycle, from purchase requisition to purchase order and goods receipt note. A department head initiates a purchase requisition, indicating its priority and adding line items with estimated quantities and costs. To create a new purchase requisition, click Create PR, fill in the necessary details, and your requisition is ready. Newly created purchase requisitions can be approved or rejected. On the Details page, you can review all requisition information. Once approved, the next role is responsible for placing the purchase order. Once approved, Procurement selects the approved requisition and vendor to create a purchase order. By clicking Create Purchase Order, items are auto-populated from the requisition. Set the delivery date and the purchase order is then sent. Next are goods receipt notes. When goods arrive, a goods receipt note is generated against the purchase order. For each item, record the batch number, manufacturing and expiry dates, quantity received, and unit cost. Let's now see how inventory is managed day to day. The stock position displays all active batches in real time. When a department requires supplies, use the Issue to Department function. Select the item, specify the quantity, and choose the department. The system automatically applies FIFO, first expiry, first out, so the batch with the nearest expiry is used first. You can also view items nearing expiry. Each row displays the days remaining with colors indicating status, red for expired and orange for near expiry. Expired or damaged stock can be written off, and once confirmed, the system creates a permanent ledger entry. The stock is removed from active inventory, but the record remains permanently for audit purposes. For medicine dispensing to patients, enter the patient and doctor IDs, select the medicine and quantity, and the system processes it using FIFO to ensure accuracy and consistency. Now let's move to reports. You'll have a detailed view of all batches, including quantities, costs, total values, and expiry status. All data is paginated for easy navigation. You can review the consumption report and filter by date range to track all outgoing transactions. The expiry report is also available and highly important. Here you'll find all expired and near expiry batches with calculated days remaining. User management is also available. Admins can create users with specific roles and assign them to branches. Activate or deactivate users as needed. When you click Create User, a new user is added to your system. Manage roles and permissions efficiently. Permissions are organized by module. To introduce a new role, simply fill in all the details and add it to the system. Now let's look at branches. The system offers built-in multi-branch support, ensuring all data is clearly associated with the appropriate branch. Next, the audit feature. Every action within the system is logged and can be filtered as needed. With deep healthcare expertise and years of experience building secure, scalable platforms, Bacancy empowers organizations to develop robust digital healthcare solutions. If you're considering building next-generation telemedicine or healthcare platforms, our team is ready to help turn your ideas into a product that both patients and clinicians will appreciate. To arrange a demonstration of our telemedicine capabilities, please get in touch with Bacancy.